This Good to Go segment is sponsored by Spectrum Health Medical Group.
October is Breast Cancer Awareness Month. I recently saw a statistic that breast cancer will affect 1 in every 8 women in the US. That's kind of scary, and it makes this the perfect time to schedule your annual screening. Dr. Erica Wrubel is a physician at the Spectrum Health Cancer Center, here to talk about why those routine screenings are so important. Dr. Wrubel, good to have you. Thanks for joining us.
Thank you very much for having me here.
What is the latest guidance in terms of the age at which a woman should have her first breast cancer screening?
So typically for average risk women, we typically start mammogram screening at the age of 40. But prior to that, starting at 25, we recommend that women undergo clinical breast exams yearly by their providers, either their primary care physician or their gynecologist, as well as perform what we call breast self-awareness. And that's a monthly breast exam on yourself so that you can notice any changes in your breast tissue over time and bring those up to your physician in a timely manner.
Yeah, I know the messaging around that kind of changed to knowing you're normal, kind of being familiar with your body and knowing when something just doesn't feel right, right?
Yeah, certainly. We recommend actually that women do the exam at the same time each month even, because your breast tissue can change in the feel or the texture of it with hormone fluctuation during your menstrual cycles. So picking a time each month to do it and being aware when something changes is a good thing to do.
I know that breast health is also a patient and physician relationship, that women should be speaking with their doctor about any concerns that they may have. But that's difficult for some women. Sometimes it might be culture, or they're just not comfortable going there. How do you get around that? Because the conversation is so critical.
So we certainly recommend that women speak with a provider that they're comfortable with and establish that relationship through multiple visits to the same provider. I think it's hard when women get seen by multiple different providers, and it's hard to bring up those conversations each time. So initially finding someone that you enjoy speaking with and that you're able to talk with up front is very important, and to switch if you're not comfortable.
I'm not sure if I heard you say then, at what point after you get that initial mammogram, how often after that? Is it every year still the guidance?
Yeah, so in the United States, the guidance still is to undergo yearly mammogram screenings. I did also want to bring up one other point, that certain populations of high-risk women, so those that have a family history of breast or ovarian cancer, should be talking to their providers about whether they would benefit from additional screening or even starting screening before age 40. So we have a high-risk program at Spectrum Health that you can be referred to either through self-referral or through your provider, and we can do a comprehensive risk assessment to determine those things.
Women who are vigilant about their breast health kind of have a sense of what to look for. But if there is a problem, does it only present in the form of some kind of a lump or bump, or what should women be looking for?
Yeah, so it doesn't always show up as a lump initially. You should also notice if there's any skin changes or any nipple changes. So especially if they're on one side and not the other, that's something to bring up. Also, any change in nipple discharge or how the nipple appearance looks. Those are important things to bring up to your provider to see if they need to do any additional testing.
I believe it is still a fact that breast cancer is a survivable thing, and that the earlier you catch it, the more likely you are to survive it. That's still a given, right?
Yeah, certainly that's the whole purpose of screening and making all these recommendations, is so we catch these things early, because they are more treatable, takes often less treatment to get you to that cure, and early detection is certainly a key.
All right, well, we always talk about it in October, but at WZZM, we set that day of the month. Dr. Wrubel, the 13th of every month, we like women to do their self-exams. But we also want to let folks know that Spectrum Health has a mobile mammography unit that travels around, and you can make an appointment to get on that unit and have your mammogram done right there. There's a calendar showing all the dates and locations throughout the month of October. They're pepping it up for October. You can see that on our website at 13onyourside.com. And if you are uninsured or underinsured, you can learn about available resources by calling the number you see there on your screen, 616-486-6022. Dr. Wrubel, thank you.
Thank you very much for having me here.